Before I welcome Erin, I wanted to kind of go over some things about tonight. We all know this can kind of be a difficult topic to talk about, puberty and sexuality and safety and shared and things like that. So I thought we'd go over some shared values and shared principles for tonight, that we first understand that this is a really sensitive topic and we're trying to approach this as inclusive and safe as possible for everyone to learn. We understand we all come from different beliefs and backgrounds. I think we can all agree that children should be loved and cared for, feel safe and protected, be respected and valued as unique individuals. And also that parents are their children's most important sexuality educators, and that we know that children are learning about these things as soon as they're born. And so we're kind of the most important person in their lives to be teaching these things. So I just wanted to acknowledge that. And we were just really passionate about bringing this information and sharing it with our community. So now I'm going to welcome Erin Montgomery tonight, and she's going to be presenting, and you might hear another staff member share a little bit also, but she'll be doing a bulk of the presentation. And so thank you, Erin, for being here.
Thanks, Melissa. Hi, everyone. My name is Erin, and I use she, her pronouns, and I'm a community health educator with Mount Baker Planned Parenthood. So I've been working with Planned Parenthood for 2 or 3 years now, in a few different roles. And before that, I was a sexual health educator at my college as well. So I've been doing this for a little bit, and I'm still learning as well. But I actually became a sexuality health educator because growing up, I had really good conversations with my mom about sexuality, and we had a really open and honest dialogue. And then growing up, I started to figure out that my peers did not have that same experience. And I felt really grateful and lucky and wanted to share that knowledge with others. So I'm just going to do a little bit of overview about the importance of sexuality education for folks with intellectual and developmental disabilities, talk about how we can communicate about our bodies and how they change as we grow. And we'll talk about the importance of privacy and consent and having conversations around that with youth. And then we are going to have quite a bit of time for Q&A. So you can save your questions, you can put them in the chat. I think you can send them to Melissa and Beverly privately. And if you have a question that comes up during the presentation, feel free to put that in as well. So one thing that's really important to consider is that sexuality for youth with intellectual and developmental disabilities is really often overlooked. There are some very pervasive myths in our society that this education is just not relevant to them, that often they are perceived to be uninterested in sex or asexual. And many parents do have concerns that if they start having conversations with their children about sex and sexuality, that will encourage sexual behavior or will encourage them to engage in inappropriate behavior. So we have a few myths about sexuality on the screen here. So I really encourage you to read through them and see if you connect or resonate with any of them. But the truth is that many people with developmental disabilities do desire relationships, romantic and sexual relationships, and can experience sexual feelings as well. So I encourage you to remind yourself that young people, your children, they have the same rights to sexuality education as anyone else. And learning about sex and sexuality does allow them to make informed and safe decisions around sex. So when it comes to expressing their sexuality, many people with disabilities face a few barriers to doing this. One of those is social isolation. So they may have less opportunities and access to meeting romantic partners or someone they want to start a sexual relationship with. They also might experience a lack of privacy. So that could prevent folks from exploring their sexuality, learning about their body, and experiencing sexual pleasure. And like we talked about, there are those pervasive myths that this isn't relevant to them. So as a result, parents and teachers are less likely to talk to youth with disabilities about sex. And so they often have a lack of information and knowledge on this topic. People with disabilities are also at a greater risk for sexual abuse due to learned compliance and being praised by authority figures for doing as they're told. So this is why conversations about consent and anatomy are so important, so that they can learn how to verbalize or articulate if sexual abuse has happened, so that they know what those body parts are called, who's allowed to touch them, and in what context that is okay, as well as who they can tell if that does happen. So youth with disabilities also might need repeated learning around these topics. Repetition really helps. And they especially might need repeated learning around what is okay in public and what is okay in private. I really encourage everyone, for all people with any kind of children, to start sexuality education early. The earlier you start, that normalizes the conversation, and that helps you to become a trusted adult. That way they can feel comfortable bringing their questions to you, and the door is then open. So that education might even begin before puberty. That's a great time so that you can start to prepare them for the changes that are going to come. And they might need more time to understand and prepare for those changes. So the sooner, the better. And it is never too late to start the conversation. So if they are already past puberty and you need some more support, it is never too late. I am kind of curious about the ages of your children, the folks in this group. So if you're comfortable, go ahead and type in the chat box how old your child is, just so I can get an idea of the folks in this room and what we're working with. Okay, so it looks like a few folks have older children. Okay, cool. Thanks, y'all. So I do want to talk a little bit about human sexuality in general. Sometimes when we talk about sexuality, people think that sex and sexuality is only about what we do, like what we physically do with our bodies, what behaviors we engage in. But sexuality is actually a lot more than that. And it's really a lifelong process. It starts even before we're born. In the womb, babies can experience erections, and toddlers are known to play and touch their genitals. So that is a very normal and natural part of being human. There are 6 different components to sexuality. So the 6 components are sensuality, intimacy, gender identity and sexual orientation, sexual health and reproduction, sexual behaviors and practices, and power and agency. So it's not only what we do, but it's also about what we feel physically. It's about what emotions we feel, relationships we have, our internal sense of self and who we are, and how that relates to others, how we care for our bodies and our health, and our own autonomy. So the importance of these different aspects can vary from person to person. For instance, some people might not place a lot of importance on intimacy in their sexuality, but for other people, that could be a really important part. So sensuality is just about our physical sensations. So touch and physical pleasure. Intimacy is more so about emotional connection to another person. So that includes caring for someone, sharing, emotional sharing, and vulnerability. And then sexual identity, that includes gender identity and sexual orientation, So gender identity is about whether someone feels internally like they are a boy, a girl, transgender, non-binary, gender expansive, or another identity. And this could be tied to how a person expresses their gender. So that could include what clothes they're wearing, how they do their hair, their makeup, even their profession or their mannerisms. Those can be tied to our gender expression. And then sexual orientation is about how our gender relates to who we are attracted to. So multiple studies have shown that individuals with autism are more likely to identify as lesbian, gay, bisexual, transgender, queer, and other identities. So as a parent, you might have a role in helping your child identify what label feels right for them, what their identity is, and keep in mind that that is something that could change over time. So gender identity and sexual orientation are fluid, and so they could identify one way now, and that could change in a year or a month. It is very fluid and changes over time. So when we're talking about bodies, as youth are growing up, I always recommend to teach them the names of their body parts, their genitals, just the way you would any other body part. Just how we talk about the purpose of hearts is to pump blood through our bodies, we can explain the purpose of penises and vulvas and uteruses and their functions. And doing this in a way that normalizes the conversation helps to reduce like that taboo around talking about these body parts. And if you give your child the language to communicate what these body parts are and how they work, you also give them an opportunity to communicate if there's an issue with that body part. So, for example, if your child has an itch on their penis or testicles, then they can communicate that to you. And if you teach them the names for these body parts, that's super helpful too, because they can communicate when or if sexual abuse has occurred. I've heard a story being a sex educator about a young person who the only name that they knew for their vulva was a cookie. And they were communicating to an adult that someone had touched their cookie. And an adult did not pick up that that was sexual abuse because the child didn't have the language to communicate what was really going on. So that really emphasizes the importance of teaching them the proper names for those body parts. And you can also communicate to them like scratching your penis is a private behavior. So by giving them language for that body part, you can help them communicate about when that body part can be touched and in what context. So you could say, if you're at school and your penis is itchy, you can ask to go to the bathroom. And in the bathroom stall is a private place, so you could scratch your penis there. So that's an example of how you could communicate about when it is okay for them to touch or talk about that body. And as you're teaching your child about their body, it's also important for them to understand and prepare for how their body will change as they grow older. It sounds like a lot of you all have folks who have probably already gone through puberty. So if we did have someone who was preparing their child for menstruation, for instance, I would recommend creating like some sort of book with the steps for using a pad and teaching them the steps using pictures or whatever way they learn best. And you could review that with them several times and have them practice with a real pad. And you could even like pour some fluid on the pad, like a colored fluid, so they could identify what it looks like when the pad needs to be changed. Or if you were preparing your child for erection and nocturnal emission, then you could explain to them that those are really normal functions of their body. sometimes they might wake up and there will be white fluid in their sheets, and that's normal and okay. But when that happens, they do need to learn to change the sheets or tell someone that the sheets are dirty. And you can even make like a door sign to hang on the doorknob that says sheets are dirty, or just inform them to tell someone else. You can also place like wet wipes or wipes by the bed, tissues to help them clean up any mess. And as they're going through puberty, hygiene is going to be especially important. So you might want to make some sort of visual schedule for their hygiene steps. So adding using deodorant and showering daily into their routine. You could create a visual schedule, place that in the bathroom somewhere they can see every day. So I do want to talk a bit about consent as well. So teaching your child the rights to consent and touch is really crucial for them to understand their own bodily autonomy. It's important to teach your child that they have the right to say no to touch. And you can practice this with things like tickling or hugs. I really encourage people to teach their children that they have the right to say no to like a hug or a kiss from a family member. And it's also important to teach your family members that they need to ask your child for permission before touching. It goes both ways. So you can also carry that practice of consent into other aspects of life, like asking whether you can come into the bathroom with them or whether you can touch them. And this will teach them that they have permission to say no. It's also really important to teach them that they need to ask other people whether it's okay to touch their body. So this is especially important for teaching them that they can't touch other people's breasts or butt or genitals, and that they need to ask for consent for any kind of touch. And there may be contexts in which your child wants to refuse touch, but it's really important, like if they're at a doctor's appointment and they need a shot or a pelvic exam. So in those contexts, I would really encourage you to still allow your child to communicate that they are uncomfortable or that they are not comfortable with the touch, but you can prime it by telling them that this is going to happen. We're going to the doctor. They might use a needle and it could be uncomfortable. After we go to the doctor, we are going to do this. And you can offer some sort of rewards, like we're going to go to the arcade or we're going to go see your best friend. So giving them informed information up front can help them to understand what's to come. And you can also talk to your doctor and ask the doctor to provide information as they're going through the procedure. So like a step-by-step. Now we're doing this, next we're going to do this, you might feel this. That can help your child to understand what's happening and make them feel like they have a little more autonomy in the process. So overall, teach your child that their body does belong to them. No one can touch them if they don't want to be touched. And if someone forces them to touch their body, they should tell an adult who they trust. You should also help your child to understand that all bodies are unique and different. As we grow up, we all start to look a little different, and that is totally okay. The diversity of our bodies is really what helps to make us beautiful. And as your child grows up, privacy is going to become increasingly important for them. So youth with disabilities have a right to privacy just like anyone else. And you may want to be explicit about the rules around privacy in your home. So you might want to be explicit about where in the home it's okay for them to touch their own genitals, for instance. Maybe this is only in the bathroom, or maybe it's in the bathroom and the bedroom, but you should specify that these spaces are private when they are alone with the door closed. And if they have a shared bedroom, then maybe that is not a private space for them. You could also consider whether your child has much privacy. Is their bedroom door always open? Are people coming in and out without knocking? Do they have periods of uninterrupted alone time? So those are some things to consider, and they may need more private time. So for example, if someone did walk in on a child when they were masturbating, that would be an instance where it's not the child's fault, because if they had the door closed and they were alone, that would be their private time. In that instance, it's an opportunity for a parent or another family member to reflect on the importance of closed doors and respecting those and knocking before entering. So let's talk a little bit more about masturbation. Masturbation is a really normal human behavior. So the important thing with this is to teach your child the contexts in which masturbation is okay for them to do. So that is probably at home, in private, with the door closed. And if they have limited opportunities for privacy, then masturbation might start happening in places that are less appropriate. So giving them an opportunity for that privacy is really important so that they recognize they have a place where they can experience that on their own. And I'd really encourage avoiding like negative remarks or punishment for masturbation, because that could lead to an internal sense of guilt and shame around the behavior. And then that could communicate to the child that it is not okay for them to do that, and it's not okay to talk to you about it. So avoiding shaming at all costs. And for those individuals who do have limited opportunities to start romantic relationships or experience sexual pleasure with another person, then masturbation might be their primary form of sexual expression. And so, for instance, if your child does begin to touch their genitals in a public area, here's what you want to do. Calmly acknowledge the behavior, remind them or explain to them that that behavior is meant to be private, and then suggest that they move to a private place. So this could sound like, I know it feels good to touch your body or touch your penis or vulva, but touching your penis or vulva is a private behavior. So you need to go to a place where you can be safe and no one else can see you. So if your child does not respond to verbal prompts, you could help them by physically moving them to a private space. So romantic relationships. Not every child will be interested in pursuing romantic relationships now or in the future. They might, and they deserve to know what attitudes and behaviors are supportive and unsupportive in relationships. So a really great way to start a conversation about supportive and unsupportive behaviors in relationships is during TV shows and movies, because they often have examples, good and bad, of relationships. And so you can prompt your child and say, how do you think that relationship is healthy or unhealthy? Or you could point out a particular behavior and say, would you like it if someone did that to you? So actually TV shows and movies and like advertisements, commercials are great opportunities to start conversations about relationships and sexuality. Like if a commercial for pads comes on or tampons, that's an opportunity to have a conversation about those products, check in about how they're working for your child, or remind them that those options are there for them. And when it comes to dating, it's also really important to talk about who is off limits. So teaching them that it's not okay to date family members, children, people who are much older than them, people and bosses or people who have power over them. So caregivers as well, professional helpers, and doctors off limits. They may also need some help talking about how to handle rejection. So maybe they find a coworker who they're really interested in, but their coworker doesn't reciprocate. So if you can teach them ahead of time that they might find someone they're interested in, but that person might not feel the same way, then that can help them to prepare for those feelings. And I really encourage you all to reflect on what your values and beliefs are around these topics like privacy and masturbation and relationships. Ask yourself, where did you get those values? And do they still fit with who you are today? Often when parents have a hard time talking about sexuality with their children, it comes from internalized shame that they experienced growing up talking about these topics. So reflecting on what your values are can help you identify what you want to communicate to your child about these topics. And I think that's about it, but I'm going to hand it back over to Melissa so we can start our Q&A.
I'm going to turn the